of Gratitude, a journey to 25,000 smiles. Operation Smile was registered in India in 2002 and launched its first mission in Assam in 2009 at the Mahendra Mohan Chaudhuri Hospital with the support of National Health Mission Assam. In February 2010, this mega mission concluded with 1,000 life-changing surgeries. Erstwhile, Operation Smile India registered itself as Mission Smile in July 2015, with the sole purpose of providing specializing corrective facial surgery and related healthcare to children and young adults free of cost. It also provides educational and training services to medical professionals under the Cleft Surgical Training Program by Dr. Hitesh.
Hello, I am Dr. Hitesh Sharma. I am plastic surgeon. I am the medical director of the Guwahati Comprehensive Cleft Care Center. This center is regarded as the world's highest volume center, and 25 surgery is a very significant number of surgery that we have performed in this center.
Recognizing the gap between cleft children and surgical redressal, the Health Department of Assam and Mission Smile signed a path-breaking public-private partnership MOU to establish a comprehensive cleft care center in Mahendra Mohan Chaudhuri Hospital. This was possible only because of the tremendous support and guidance of the then Chief Minister Shri Tarun Gogoi and Dr. Hemanta Biswa Sarma, who was the health ministers at that time. With the backing, funding and support from Tata Trusts, Mr. Manoj Padale from Operation Smile UK, Government of Assam, National Health Mission, Max Bupa and Stryker, the state-of-the-art comprehensive cleft care center was inaugurated on the 9th of May 2011. Within a year of its inauguration, the center reached a milestone of 5,000 surgeries in 2012, effectively clearing a significant patient backlog. By the following year, the team celebrated its 10,000th surgery, highlighting their dedication, commitment, and exceptional surgical skills at GC4. From 2014 to 2019, the center achieved another impressive milestone, reaching a total of 20,000 surgeries.
When this center was started, there was a huge backlog of patients who were unattended, who were not treated, and they needed this treatment. So not only we have covered the backlog, we have come to a stage when we are giving services as and when new patients come. So we have streamlined the services of cleft surgery, not only in Assam but almost entire Northeast.
During this period, the center gained global recognition and drew attention from cleft surgery fraternities worldwide, positioning Assam positively in the global cleft care domain. Since its founding in 2009, over 2,000 medical and non-medical volunteers from around the world have visited the center, transforming thousands of lives. Mr. Ranjit Borthakur, co-chairman of Smile Asia, whose vision has empowered Mission Smile's impactful work in Assam and the Northeast.
I think we'll leave a legacy of smiles. I suppose that would be the right thing to say. And that is really what we want to do. We want people to smile and we want families to smile, because one smile patient causes so much grief to the patients and also to the families and also to people around. So I think the legacy that we want to leave behind is about 3-4-fold. One is pertaining to the fact that we want to leave behind smiles. Two is we want to leave behind a very important message for people in Northeast and Assam, is that, look, it's possible. What you want to do is possible. And it is not that the government is not impossible. You have to be able to carry government and convince government. And therefore, government, Assamese people of this genre should understand when you have a will, you can do it. You have to put the package together so it does well. Thirdly, we have to actually work very hard in terms of getting people to volunteer, be it the medical people or otherwise. So that volunteering process is actually a very critical thing that we encourage and we do, which includes training and development of our staff and otherwise. So I think there are three really paths that I would like to leave behind as a legacy. But the message there is what can be done has to be done, and we must do it.
In 2020, the COVID-19 pandemic tossed us into uncharted waters, bringing all our operations to a standstill. But we didn't let COVID stop us. We provided over-the-phone counseling to the patients and provided them with food supplements until we could resume surgeries. We did not let yesterday take up too much of today and looked ahead as we spread smiles and changed the lives of many little ones who were waiting for their smiles. The government took a commendable decision to rebuild MMCH into a world-class multi-specialty center. However, this caused GC4 to find a new location to continue its work. With the support of the Honorable Chief Minister of Assam, Dr. Hemanta Biswa Sarma, we were allotted the Bagri Hospital to continue spreading smiles.
The journey of Mission Smile started in the year 2002. And since then, we have a lot of people to thank for. Because without their support, this entire journey of 25,000 surgeries would not have been achieved. At the foremost is the government of Assam. Without whose support, we would not have been able to initiate. They gave us space, which was instrumental in building modern operation theaters along with an international organization called Operation Smile. This formed the basis of the entire journey, and we have now moved from the Mahendra Mohan Chaudhary Hospital to the Bagri Hospital, and we are looking forward to moving back to the premises of the Mahendra Mohan Chaudhary Hospital in much larger space where we hope to expand our services. Our special thanks, in addition to the Government of Assam and the National Health Mission Assam, is to the donors, without whose support we would definitely not have been able to fund this entire activity, because if they were not there, we would not have existed. The third and the foremost important component in this entire activity are the team. The team consisting of doctors, anesthetists, nurses, ward boys, marketing executives, people who've gone into the interiors of the country and built in patients who needed these surgeries and brought about awareness of cleft lip to this entire region, which has helped us to be able to harness patients who needed our treatment. We are extremely grateful to the patients for having given us the confidence and let their entire medical services over to us, and we have taken special care to be able to get to the best results with them.
With years of experience and an optimistic mindset, Mission Smile progressed towards a major milestone: 25,000 smiles. Smile is hope. Smile is strength. Smile is a brighter future.
Greetings from Mission Smile. We owe a debt of gratitude to the governments, to the volunteers, to our funders, friends and well-wishers during our run-up to 25,000 safe surgeries at our GC4 center. People look at these little children disfigured and ask themselves why. At Mission Smile, we look at how they ought to be and ask ourselves, why not? We look forward to your continued support as we power on from 25,000 to 50 and onwards till we have an Assam and a Northeast that is smiling and cleft-free. Thank you very much.